I don't know if you've ever interviewed Valter Longo, but Valter's done some amazing work with cancer patients. He started with rodents, and he found if you fasted them 24 hours before they got their chemo treatment, and really it's more like a calorie restrict 5 to 1,000 calories, and then the day of the chemo, 500 to 1,000 calories, and then the day after the chemo, 500,000 calories. In rodents, they found that the cancer was annihilated better, and also that the rodents had less side effects. And then when he started to do clinical trials with humans, he's finding the same thing. So normally when I'm counseling my patients, like this one ovarian cancer patient that I'm just talking to, instead of getting like a big dose every month, there's something called metronomic chemo, where you give, let's say you were going to give, 100 milligrams. Well, you give 25 milligrams each week. And what they find is you have much less side effects, and you don't give the angiogenesis a chance to redevelop in that 1 month period. So a lot of times I'll tell them, hey, listen, go to your oncologist and see if he'll do your chemo metronomically, rather than giving you like a big dose. That's what I told this woman. So there's ways that you can, do all of these different supplements that I recommend. I know you probably have heard this, and I think it's a knee-jerk reaction. A lot of oncologists, they tell their cancer patients, don't take any supplements while you're getting the chemo. And I always, there's a section in my book, I go over a couple really good studies. One was by Dr. Keith Block. He looked at 965 different studies. It was a meta-analysis, and he wanted to see, these were people that were taking antioxidants during their chemo treatments. And he found that people actually did much better. They were able to finish their chemo treatments. They had less side effects. I mean, there was only one that had a side effect, and it was vitamin A overload. That's a fat soluble vitamin. They just overloaded on it. Mm-hmm. And then there was another one. It was a meta-analysis of 280 studies that showed the same thing. And one thing, I've actually gotten arguments on the internet. There's this one guy, David Chan, on Core Digest. Smart guy, but he really doesn't know anything about nutrition. And 20 years ago, there was a very potent IV antioxidant called amphipostine. And it was made for people to get radiation so that it doesn't damage all the peripheral cells. And it was also for certain types of chemo, so it doesn't cause peripheral damage. And what they found was when they did this, it had absolutely no negative effect on the end result. So I always bring it up to these guys. I say, okay, you're going to give like this potent IV antioxidant, and then you're telling people they can't take some vitamin C or turmeric or, noni fruit or, ginger or garlic. It's kind of, it's actually absurd. So I always tell my patients, I'm not telling you to override the oncologist, but I think you're going to be better off doing supplements. So supplements are number 2, exercise is number 3. And I think that's probably one of the most important things. Stress and sleep are number 4 and 5. But I always tell people, if you're exercising, your stress is going to be less. And if you're exercising, your sleep's going to be better. So, exercise is incredibly important. In fact, I always go over this one study. I have it in my book, and it's almost unbelievable. It's patients that, first off, if you exercise regularly, your chances of getting most cancers, it decreases anywhere from 10 to 35%, depending on the type of cancer. But if you get breast cancer, especially, this one study looked at women that had breast cancer, and if they just briskly walked for 30 minutes a day, they lowered their risk of getting a relapse by 24%. If they ran 2/3 of a mile per day, they lowered their risk of a relapse by 40%. And if they ran 2.3 miles per day, they lowered it by 95%. It's almost unbelievable, but exercise has this incredible effect on your immune system. It upgrades your tumor suppression genes. It makes your innate antioxidants work more efficiently. It makes you more insulin sensitive. And that's the other thing that most people don't realize, is that when you are not metabolically fit, if you have if you have even pre-diabetes, which 38% of the population has, your body is not going to be able to get the sugar into the muscle or the liver cell, because basically it's saturated, it's fatty acid accumulation that occurs in the muscle cell, and it really mucks up the GLUT4 receptors. So the sugar really, can't get in well. So the insulin levels really jack up. But what people don't realize, insulin is one of the most anabolic growth promoters in the body. In fact, when they do rodent studies or petri dish studies and they want to get the cancer cells to grow faster, you know what they put on them? They put insulin on. Yeah. So really, making sure that you're not pre-diabetic and you're metabolically fit, and probably one of the best ways to do that is through exercise, and especially resistance exercise. You really have to make sure that you maintain your muscle mass. So I put together a little video where I do I go through these different resistance exercises, and in my book I have a really interesting study that showed that just doing 6 minutes of exercise jacks up your natural killer cell activity by 50%. So a lot of times patients will go, I don't have time to exercise. I say, you know what? Just do 6 minutes every morning, because it's definitely going to give you some benefit. It's really the consistency more than anything.